Last month, the Minister of Health, Dr. Frank Anthony, revealed that Guyana has joined the COVAX facility, which allows for equitable access to COVID-19 vaccines once they're licensed and approved for third world countries. Most of the vaccines invented to date are still going through clinical trials, and once the requisite manufacturing approval is given, the vaccines will be distributed to the enlisted countries at an exorbitant cost. However, Dr. Anthony, during a recent interview, divulged that Guyana will be exempted from paying the full cost of the vaccines.
GAVI has made Guyana one of 10 countries that would be eligible for a subsidy, meaning that if the vaccine costs, say, $10, that GAVI would take a substantial component of that cost. So Guyana would pay far less than the actual cost of the vaccine.
GAVI is an organization based in Switzerland that is co-leading the COVAX facility. Its focus is to improve access to new and underused vaccines for children living in the world's poorest countries. The minister further stated that GAVI is expected to make a definitive decision on the subsidy amount by the end of this month.
So once we know that, we will then know how much on behalf of the government of Guyana we'll have to put in so that our entire population can benefit.
He noted, too, training of health personnel to effectively administer the vaccines has begun.
We have started, and we will start to prepare our health workers, train them so that they can administer vaccine. A lot of them are already trained because they've been doing this with some of our other immunization programs. But we want to train more people because once we get the vaccine, we want to be able to immunize a large portion of our population very quickly.
The government of Guyana has also begun talks with Russia and India as alternative sources of COVID-19 vaccines. Meanwhile, approximately a week and a half ago, a generic version of remdesivir was introduced as another treatment option for COVID-19 patients. The drug, which is being sourced from manufacturers in India, is now part of the local regimen, along with hydroxychloroquine and chloroquine pills. Additionally, the convalescent plasma therapy is still an existing option to preserve the lives of critically ill COVID-19 patients. Temika Rodney reporting for the HGP Nightly News.